I want to focus on a more immediate at hand problem. Is HMPV the new COVID-19? That's the fundamental question. This strain of influenza has already created chaos in China, where once again it has broken out near Wuhan. Hospitals are packed and overflowing with patients. The influenza has been around for some time and there are no medicines that can treat it, and neither are there any vaccines. Thankfully, as of now, it isn't the killer that COVID-19 was. It does create breathing difficulty and is known to hit infants and the old and infirm, but only in severe cases does it lead to pneumonia. Unfortunately, the HMPV strain has been detected in India. There are a handful of cases that have been observed in Karnataka and Gujarat. The news led to a sharp correction in stock prices, and the government came out with a statement. JP Nadda, Health Minister, came out and said health experts have clarified that HMPV is not a new virus. It spreads more during winter and early spring months. Health Ministry, ICMR and National Center for Disease Control are keeping a close watch on the situation in China. There is no reason to worry. Health systems and surveillance networks remain vigilant, ensuring the country is ready to respond promptly to any emerging health challenges. The symptoms of HMPV are quite like those seen in patients with mild COVID-19 infections. And viewers, as we go across to Dr. Bagai, we're going to leave on the screen a quick summary of the symptoms so that you can have a look at it. In moderate cases, persistent cough, wheezing and fatigue. Severe cases, bronchitis, bronchiolitis or pneumonia, as I said. And you can see some of those symptoms. Dr. Sanjeev Bagai, chairman of Nephron Clinic, is here with us. Dr. Bagai, how wary should we be of HMPV and what to do to avoid it?
So this virus, which is called as metapneumovirus or human metapneumovirus, is not a new kid on the block. It has been in existence for the past 2.5 decades. It was first discovered in Netherlands in 2001. And thereafter, it has been circulating worldwide. There have been surges even in Vietnam, in Japan, in China, from the year 2003 till 2018, various outbreaks. So it's not new. But I think this is the outbreak coming now from China, in which we've seen few cases here in India, and we have isolated the virus, is a cause of bringing attention towards respiratory infections. In winter months, the respiratory infections do increase, especially in children, and this peaks between the age group of 6 months to 12 months.
What are the precautions? How do we avoid this, Dr. Bagai? How do we stay safe?
Yeah, so a host of viral infections infect the respiratory tract in children. It's the commonest ones. And the common ones, apart from the metallovirus, pneumovirus, is HSV and indeed influenza, amongst others. So I think what we need to do is to keep a safe distance, especially children not being exposed to very close, crowded areas, poorly ventilated areas, exposure to extreme cold. If anyone has a cold and cough, they should keep themselves away from the crowd. Wearing a mask is extremely important, even for parents, because very often they can be asymptomatic carriers, bringing the infection to the children. Look out for early signs of breathlessness, cough, fever, rash. Don't self-medicate. Keep yourself well hydrated, good nutrition, and make sure that the child is well fed. Look out for signs of panting, breathing difficulty, and so on.
Well, Dr. Bagai, thank you very much for putting this into perspective. Of course, we'll be following this story very closely, viewers, and keeping you updated on latest developments, even if it means that we have to put down more resources in harm's way. Thank you very much for watching. Palki Sharma with The Vantage, where we're going to look at the Canadian story as well as, of course, the HMPV.